Thanks so much, Crystal. So we have a really good chat in line for you today. So Dr. Amit, can you please tell us how you've tried to go beyond point solutions to offer a comprehensive solution for chest X-ray analysis? Is your microphone working?
Hi. Yeah,
We can hear you.
Yeah, thanks for this question, and thanks for this wonderful audience here. I think the most important thing about the chest X-ray AI, I think, is how do we satisfy the radiologist's requirement of being a comprehensive solution. Being comprehensive means we are able to do everything on a chest X-ray which the radiologists do in a general clinical radiological practice, and it's a big ask, it's a big demand. So the approach what we have taken for that is called the CAD-E approach in terms of the regulatory clearance. The CAD-E approach is more or less primarily an organ-based approach, which allows you to look at the X-rays not in terms of a point pathology, but rather in terms of the lungs, in that the pleura, the heart, the hardware. And that approach is called the CAD-E approach, while the other approach is the CAD-T approach, which is the triage approach. In the triage approach, you do the point conditions like lung nodule, pleural effusion, so on. So we decided to use the other approach. It was a long approach. It took more than 2.5 years to complete the regulatory clearance. And it required more than 27 US board certified radiologists to do the study. And it had multiple periods of wash in and wash out. And once we did that, then we were able to present the result. And the result showcased that using this, radiologists who were aided by AI were able to perform significantly better. And we could demonstrate that both for the standalone study as well as for the unaided and the aided study. So that's been the journey. And our journey is the CAD-E journey. And we are currently, we believe, the only commercially available CAD-E solution for the US market. So that's a very short, quick brief about it. Thank you.
Thank you so much. Vytautas, would you like to comment and share more about how you tried to go beyond this?
Yes, thank you for your question. So we also started with CAD-E approach in Europe, and we have first C certification for 75 pathologists in 2019. And we quickly understood that, yes, it's a nice, and we call it gadget, for people to see what is there. But in order to really start the implementation, you need to create a real value. So we decided what could be done for chest X-ray. So one thing is accuracy, and another is productivity. And honestly, I believe, and the feedback from a client said that currently the problem is not with quality of radiologists, but scarcity of radiologists. For this reason, we said, okay, how can we help with chest X-rays? And we did a lot of trials. I will not go into details. And we found out that only autonomy could really save time for chest X-rays. And we then start working. Again, took 2 years or so to get certification for ChestLink, which is still the only C-certified autonomous AI for chest X-ray. That means if it's confidently normal X-ray, and it's normal, so we can write a report instead of radiologist, and then radiologist doesn't even need to look at it. So that saves all the time for a chest X-ray, and it's really clinical and financial value for a client. What we also understood, okay, this is nice part. We still have our CAD-E, it's certified. What can we also include for quality? And then we had a solution, combined computer vision with natural language process. So after radiologists write a report, we can read a report and find if there's something missed. So that case, we can really help with quality without reducing the productivity, because the worst thing what could happen for radiologists to get false positive, that we need to look at something which is not fair, and it actually reduces the speed. So now if we combine all of this, we can help productivity with ChestLink, and then quality with our just high quality product, and in combination and really solve both problems, productivity and accuracy.
Amazing, thank you so much. Stefan, would you like to share more about how Rayscape, what you're doing?
Definitely. In terms of the approach, we're going back to CAD-E, so we had a bit of a spiral here. When we started working at Rayscape, what we basically did was we went to the radiologist in our network and tried to understand exactly what they would like to see in a tool that help them analyze chest X-rays. And basically the answer is that they wanted a tool to do everything, which which is very difficult to do. We understood with that it has to be comprehensive. So what we did was we taken an approach in which we created a data set of a lot of different findings. So the data set that we train on, it actually has 148 findings that are covered. But that is way too comprehensive. Information for radiologists is just too much. It's very difficult to follow. It's also much more difficult to get through regulatory approval. So what we did was we compressed those 148 different findings in the data set into 17 classes, of 17 labels, as we call them, which basically comprise them. And this version of doing it basically has a lot of complexity behind it. But it also, that is shown to the radiologist, but it does not overwhelm him with a lot of information that he otherwise wouldn't use or find useful. Additionally to that, we found some other features that they themselves found helpful, like bone suppression, bone subtraction, cardiothorax ratio calculation, and segmentation of the heart, which we also added to our tool to complete it and make it more comprehensive. So that's the approach that we took.
Amazing. Thank you so much. So 3 slightly different and varied approaches, which is awesome to see the innovation amongst our different partners here. So thank you so much. So Amit, please can you tell us about your unique approach to FDA submission and approval?
Right. So I covered part of it in my earlier kind of discussion, but just to tell, the CADI approach is very unique. And we believe very strongly that this could be the approach which will the best suited for the radiologist workflow, in which we are not entering a territory where we are going to go and talk about the point conditions which really don't create significant impact, because the radiologist beyond so many different things when we are looking at a image. And I think the CADI approach is going to be the future. And I think that journey we started, as I said, more than 3.5 years back, and it took more than 2.5 years to finish. And over a period of time, I think that's going to result into the US FDA equivalent of the normal abnormal. I should not say normal abnormal, I can also say it is low suspicion, high suspicion, or AI finding negative or AI finding positive. So the future is that. The future is eventually, maybe not now, in the 3 years or 5 years or 7 years, you'll have your x-rays which are completely normal getting separated out from abnormal, and that's possible because of the responsible AI framework. So it's going to be a large study, a multi-centric trial across multiple institutions, probably in somewhere in the future, where we'll be able to clinically demonstrate that the CADI solution is the right approach, and over a period of time, across multiple radiologists, across multiple data sets, you have very confident that solution has reached a maturity of separating these x-rays into this low and the high suspicion category, and it can be used in the US for signing off all your normal reports. So that could be the future, and I think that's the approach that we are taking. And the second important approach my colleagues have also covered is that in terms of the radiologist workflow, and building the regulatory journey is one thing, but getting it inside the radiologist workflow, in the packs, into whatever systems, EHR, EMR systems, is going to be a second journey altogether. And the most important aspect here is the adoption. How do you flag it on the work list and so on and so forth, and then that's a separate part of the journey. And the CADI solution, you may not be able to change your work list as you do in terms of a triage. And that brings in a separate kind of a regulatory framework. So you have to manually segregate your studies or triage. There are challenges, there are opportunities. It could be a combination of solutions that may come in. There could be tandem solutions that may come in. And I believe a lot of things will be happening in the next 3 to 5 years to get a more clear picture about it. I hope I am able to justify my answer.
Thank you so much. So, Vytautas, how far away do you think we are from autonomous AI for CXR reporting?
So the correct answer for this is it's already there. So we have already in Europe clients who use it fully autonomous for their everyday use in clinical setting. So the question would be when it will be common for everyone. That will take at least a few years, and I believe that with our comprehensive solution we'll bring it. The interesting thing is we'll have also in United Kingdom we have partners, University Hospital Birmingham Trust. We did almost 90,000 chest X-ray study to prove how much we could automate, it's around 26% could be automated, which translates into real value immediately for a client. We also have a first tender which was mentioning autonomy in the requirements. So in Europe, I would say autonomy in the next 2 to 3 years will be common practice. To be honest, in the United States, I think it will take a bit longer to adapt. And I think it's a very good approach that you're taking, and we are also taking the same approach at the moment to ensure that we can have confident normals separated. It will not be autonomous from the start, but it's a first step how to move to autonomy and to prove in this multi-center study. So again, autonomy is already there. If you want to learn more, we can talk afterwards, but hopefully in 3 years I can tell, and it will not be a question anymore, it will be just a common practice.
Okay, Stefan, so we know that in the EU you have 148 CXR findings of regulatory approved. What are your plans for the US market?
That's a very good question. I think, you know, a bit about the US FDA approval process and how it can be tackled was already mentioned, but for us and on our side, we feel like the way that it's currently has gone with the step-by-step approach to each and every finding is not something that's going to you know, be scalable. It's not going to work on the long term, right? So on our side, what we're currently doing is we have submitted a pre-submission form with the FDA, with QSub. We're trying to discuss and understand exactly what they would like to see for an approach that would either go for multiple of those, again, not the 147 that we have in the data set, more likely more of this, like 17 that we have in our labels, or sort of an autonomous solution that the guys were mentioning earlier. In both cases, we'd like to understand exactly what they'd like to see, and then we are going to try to take the easiest approach to it. We're going to see exactly, obviously there's a lot of resources involved in this, so we have to see what's feasible and what not. So yeah, definitely scaling and getting it regulatory approved with the FDA after the EU is a fun thing to do. But as you mentioned, I think everyone's going to go there in a few years. It's probably going to take a bit longer than in Europe, but we're going to get there for sure as an industry, I mean. So yeah.
Thank you so much, and thank you so much for your time today, Amit, Vytautas, and Stefan. We really appreciate you coming to speak, and we hope you've all enjoyed it. Thank you so much. Join us here for more.
Thank you.